Welcome. My name is Melissa Hagerstrom. I am the Associate Director of Undergraduate Recruitment for the Bouvet College of Health Sciences. We're really happy to have you joining us this afternoon or whenever you're watching this recording to learn a little bit more about the academic programs we have within Bouvet. For the next 45 minutes, we're going to share some information about two of our really strong majors within Bouvet, the bachelor's degree in science in health sciences and our bachelor's of arts in public health. So health sciences and public health. So we're going to share some information about what the curriculum in those two programs are, what you'd be learning, where these degrees take you, the similarities, the differences. And then I'll be joined by Rebecca Stoof, who's going to share some information about the program, and three current students who can share their experiences. They're also really excited to answer any of the questions that you might have. So please feel free to utilize the Q&A feature in the Zoom webinar. Please put all your questions in there. We're really happy and excited to answer anything you have. I'm also going to share my email with you, so feel free to send me an email at any point if you have any other follow-up questions. I know we can't always cover everything that you're wondering, and questions do come up at different points during the college search process. So I'm always happy to help answer any questions as they do come up. We're also going to share a PDF of our curriculum book. It's really helpful. Our students are probably going to be talking about co-op and when they're in classes and the academic schedule at Northeastern. So this is a really great visual to kind of see how the semesters are laid out at Northeastern, because we can be a little bit different than some of the other programs that you might be looking at. So it's definitely worthwhile taking a look at that. So with that being said, I'm going to hand it over to Rebecca.
Thanks, Melissa. Hi, everyone. My name is Rebecca Stoof. I'm the Assistant Program Director for undergraduate programs in the Department of Health Sciences. And like Melissa said, I'm going to be speaking about two of our programs. But first, I'm just going to jump into talking about public health. Speaking specifically at a very particular time that we're all experiencing in the COVID-19 pandemic, and how much this has put public health in the spotlight. In previous webinars, when I would talk about these degrees, and especially public health, I would assume maybe like half of the people would be familiar with public health. But now with COVID-19 and the pandemic and all of our global experiences of understanding public health kind of in our minds and very vividly seeing it play out over the past year plus, we can see that there are probably a couple things that come to mind now when we think about public health. So instead of me giving examples of public health, there are probably a few things that are coming to your mind right now that you could say, oh, I can identify public health right now. And if you think of those images right now in your mind and kind of think about them, and I'm going to kind of guess what some of the maybe the top 3 or 4 probably are in this group. So public health is many things, as I'll talk about later, but a big part of it is prevention. So as you see on the screen, there's a lot of prevention happening with hand washing and mask wearing, distancing, trying to stop the spread, but also a big portion is also around monitoring. So doing testing and tracking incidences of COVID infections, looking at hospitalizations and really studying how these incidences are happening and where they're happening. That's a big part of public health. Additionally, vaccines, as you know, it's a very real thing right now that we're all looking at and seeing the uptake, the numbers across maybe your state, the country, the world, and utilizing this mRNA, helping the body actually produce sort of a practice of addressing if it came in contact with COVID-19, what it would do. So that's also a side of prevention, but also a big part of public health when thinking about other parts of healthcare that you probably have also known about. I wanted to kind of go back in time and talk about that there was, for many years, finally a shift in thinking about health. Again, when I said maybe half of the people typically over the course of the years I've been doing this think of health and think about healthcare. So think about diagnosis, trying to figure out what's wrong and treating what's wrong, as opposed to thinking about the whole person, thinking about, like I said, prevention, thinking about monitoring and figuring out the trends. So you could say, oh, this is an actual pandemic, or this is an outbreak, and be able to address it. And additionally, quality. So a big part of public health is saying, how do we make sure that the best healthcare, the best approaches are used, and how do we share that information more broadly? So that paradigm shift happened, and it's really been a big key part of healthcare practitioners training. They keep now thinking more about prevention when they talk to their clients, their patients, and about promoting health in a larger sense, as opposed to just focusing on what's wrong and treating what's wrong, and not thinking about the whole person, the community, the context. So are there anything, again, trying to elicit some images, some thoughts about public health? Are there other things that you're thinking about aside from the couple examples that I gave? Here's a couple more, again, thinking more broadly about when you see these images, what's going on here in public health. So especially with the pandemic, a big thing that's been focusing on is how to keep people having access to the food they need. How do they make sure that they have, if they can't work, how do you make sure that they're able to afford food, to afford rent? So stimulus checks, policies around how to make sure they have access to clean water, and telehealth because they can't go to the doctor anymore. So there's so many dimensions of public health. And again, you can see it right now, but also you can see it before and after now. You might be able to start to see it as you just move about in life. So yeah, I wanted to kind of touch on those couple things that you might look at and see, oh yes, there's things I can see day to day, and really interested in solving those problems, seeing the challenges ahead of you, and want to participate. And again, there's two different degrees that we've kind of structured now to help students that are interested in these big health issues, big challenges that we're all facing. And we've put them in two different degree programs. So for people who are interested in clinical, like I said, healthcare providers, medical doctors, physician assistant, physical therapists, they're thinking about how do we treat the whole person? How do we understand the context of what's happening in this patient's life, in this community, to provide better healthcare, quality healthcare, and actually promote health in the community, as opposed to just trying to treat disease and address things individually. So thinking bigger picture. So the BS in health science is the track that we have created for those specific people who are looking for the clinical, the science foundation, and wanting to really embed and create a foundation for themselves in sciences and public health. And if you are thinking about pre-med or thinking about going to dental school, especially with medical schools, it's a big thing that over the past couple of years that they're really emphasizing, that there's, of course, the prerequisite courses. So they want biology and chemistry and physics, but they really want students that are coming with the public health knowledge. That's a big suggestion when students are considering. The Association of American Medical Colleges really suggests students going on a public health pathway to gain the necessary experience to prepare them in even a more holistic way, rather than just taking those prerequisite courses as they prepare to apply to medical school. And then the other side is, like Melissa said, another degree, a Bachelor of Arts, which we have created for students that are not as interested in taking the science courses and going in that clinical path, but are really, again, thinking about these big challenges and thinking about how does it involve businesses. Like I said, there is a lot with the pandemic about how do you keep businesses open, how do you keep it safe, but also have people be able to access food and the fresh groceries that they need. government policies, how do the policies get determined? How do you, utilize policy and change policy? All of those particular types of careers or pathways are great within the BA, because that's where we have a lot of emphasis on those types of courses and experiences to prepare for even a couple more on the screen, like law school, going into understanding a lot more around community and social behaviors and how to really support the work and with that knowledge, as opposed to, again, going into a more clinical path. So I'm just going to talk briefly about some of the courses, and there'll be a curriculum book that you can kind of explore a little more about the courses and how they happen over the course of a major. But I wanted to just emphasize how much the public health courses here on the screen really come together and are the foundation of the health science, Bachelor of Science degree and the BA Public Health. So no matter what path somebody's on, either the BA going into, again, like I said, pathways towards law, policy, maybe global health, those pathways are all founded on core principles of public health, which are learned in these courses. So learning about the American healthcare system and other healthcare systems around the world, learning about the core parts of public health and the approaches in public health, learning about communication, especially around health communication, how to communicate to different audiences, key skills in biostatistics and epidemiology, policy and health education, and of course, looking at it from a socioeconomic lens and understanding how different factors in specific contexts affect the ability to be healthy, to get what is needed to be healthy. So all these courses are at the core of both degrees. So no matter what path is chosen, students get the core courses in public health to found that to really ground them in the knowledge and skills, no matter what pathway they take. So with that, that was a really quick and hopefully inclusive of a lot of details about the two degrees. Like I said, explore that curriculum book and kind of see it visually. But at this point, I wanted to turn it over to hear more from the students, because they are the living example of taking public health and in the pathway that they want to take. So I'm going to turn it over, and I'm welcome to questions later on if anyone has questions.
Perfect. Thank you. There are a few coming in, so we'll definitely get to the question. But I'm going to have Nicole, if you can introduce yourself first and share a little bit about your background and what you've been doing your time at Northeastern.
Sure. Hello, everyone. So my name is Nicole. I am a current senior at Northeastern. Just to tell you a little bit about myself, I'm a health science student. I have completed 2 co-ops now. I worked at Mass Eye and Ear, which is a hospital up here in Boston. I worked in the OR while I was there. And then my second co-op was doing research at Mass General. I'm also on the pre-med track, currently applying and interviewing with medical schools. So if anyone has any questions regarding being pre-med at Northeastern, I'd be happy to address those as well. Outside of the classroom, though, I spend a lot of time in different clubs like student government, and there's American Medical Women's Association here that is a great club for females who are in medicine to join. And I like spending time in Boston on the weekends, because why not, right? So that's a little bit about me.
Thank you so much. Eugenia, if you can introduce yourself.
Hi everyone, my name is Eugenia. I'm from Miami, Florida. I'm also a health science major, and I have a nutrition minor, also on the pre-med track. I came into Northeastern through NUN, so I studied abroad in Dublin, Ireland, my first semester. If you have any questions about that, feel free to ask. It was an awesome experience. And then I also have completed 2 co-ops. My first one was in Mass Eye and Ear as a retina tech. And then my second one I just finished this past summer, and I'm currently working per diem at Brigham, and I work in the gynecology department as a medical assistant. I've also done some research through Northeastern at the Center for Cognitive and Behavioral Sciences, And it was a great experience, like learning more like clinical research and engaging with like the participants and also with the research coordinators. That's pretty much it. I also was part of AMWA, but I've been interested in like being more involved in like the Hispanic community. I'm Venezuelan, so I'm also involved in that. And yeah, I guess that's it.
So funny. Students are always like, list 100 things. Like, I guess that's all I'm involved in. I think the theme of Northeastern students is involvement. Students are very involved and active here. Alyssa, if you can introduce yourself.
Hi everyone, my name is Alyssa and I'm part of the Plus One MPH program. So I graduated from Northeastern this past May with a Bachelor of Science in Health Science and minors in Spanish and Biology. When I started off, I was pre-dental. So before settling on the public health track, my first co-op was as a dental assistant at a pediatric office. And then my second co-op was at a Institute for Healthcare Improvement here in Boston. And I was a public health research assistant. And that was more on like program management and evaluation. And I've been a research assistant for a few Northeastern professors, like touching on wet lab work, environmental health, and then health disparities. So kind of like getting to where I was interested in. And I've just recently started another research position that's clinical research, which is what I've like finally settled myself on. So I do appreciate having like the science background, even though I'm more focused on the research aspect, if that makes sense.
That's great. Thank you so much. So we have students here who have similar interests, but have kind of taken different routes to go in the directions that they're going in, which I think really highlights how versatile these degrees really are. You don't need to know, well, why don't I ask? So Alyssa, you came in pre-dental and then changed directions. Nicole, did you know what pathway you were looking to go on? Do you want to talk a little bit about that and how you?
Yeah, no chance. I don't think that anyone really knows going right into high school. I mean, some people, they know they want to be, let's say, a doctor from the time they're 4 years old, and that was definitely not my case. So the reason I really settled on Northeastern was because of the co-ops. I would be able to test it out, and it was, you only spend a few days in the OR before you realize, like, yes, this is exactly what I want to do, or maybe I have to look at a different direction. So it really came down to that experience and deciding what my career is going to look like.
That's great. Eugenia, did you know what you wanted?
I knew I didn't want a pre-health experience, and I didn't want to do biology or chemistry because I was more into public health, and I felt like health science kind of balanced both of those things out. But I wasn't sure if I wanted to do pre-med, pre-PA. I knew Northeastern had a PA school, but then like I did a lot of shadowing, and then I decided that I did want to be pre-med.
Great, thank you so much. Yeah, so I think one of the things to know is that you don't need to know exactly what it is that you're looking to do. I think health science and public health as two degrees, they're both great at getting students in various directions that are pretty, broad, but also you're giving you really specific skills that you need. So you're going to be really successful no matter if you do want to go to medical school or if you're looking to go into clinical public health research. Like, you're going to have the foundational skills you need for those. So I think that's a really important thing to know. So there's some really great questions coming in. Can we talk a little bit, Rebecca? A student wants to know if they could combine the two degrees. And I think you sort of answered that, but this is just like getting right to the meat of the matter. So could you combine both degrees, and why not? Or why or why not?
Yeah, so I would say the simple answer is no, because they're very, very similar. So there's only a couple things that are different, again, depending on what a student wants. So if a student wanted to have the science foundation, again, like I said, the health science degree is the great path to go on. The things that are different in the BA degree, students can still do in the health science degree. So you can still minor in global health or minor in nutrition, or do a minor in another college and do a minor in business, or even something fun like theater or something. But you still have the opportunity to kind of mix and match. But again, at the core is the public health. So you don't actually combine because a big part of it is the same. So those courses that I listed are the core that are at both. So there isn't much more that's to combine once you look at how similar they are next to each other. But again, the big portion is around the science courses that, deciding kind of, oh, like I do like biology and chemistry, and I want to also go in a clinical direction. The BS Health Science is a good way to start. And then if you decide, actually, I might want to go in a different direction and focus on public health, you can shift to a BA degree. So we don't split because they're kind of issued as separate things, this Bachelor of Science or a Bachelor of Arts. So, but there is a lot of overlap that you can be able to move between the two if you just make your decision in year 2 to be a Bachelor of Arts student. You can do that. I hope that answered it.
That was pretty great, I think. There's a question about a popular graduate programs that students go on to after undergrad. Alyssa, can you talk a little bit more about what the MPH is? That is a very popular option, and then I can expand upon it a little bit.
Yeah, so I did say +1 MPH, but I didn't say what that was. So it's Masters of Public Health. So the +1 aspect of it is that I started taking graduate level classes in my senior year last year while I was still taking undergrad classes, and then I graduated and then just continued into the summer, and then I'm going to graduate again in May, but this time with a second degree, my master's. So a lot of students will do that, even if they're just like very pre-med. If you want more specialization in public health, some people do that as like a gap year in between going to more graduate school. And then there's also, other levels. So I'm interested in a PhD, so I might do that after. And Northeastern also has a population health program. So, but yeah.
Triple Husky, I love it. And I think the student asking too, they're looking for specific schools that our students go on to for graduate programs. And I don't have a list available right now, but our students are really competitive applicants for any graduate programs that they're looking at. Our students academically are really well situated to apply into some of the top ranked programs. They're also really have really intense, comprehensive resumes that they're coming out with. I know we kind of mentioned co-op and kind of glossed over it, but if you haven't attended any of the Northeastern general information sessions, I'd really recommend doing that to learn a little bit more about co-op, but we can talk about that more here too. Co-ops are 6-month-long work experiences where students are taking time off their academics to gain real world experience in the field. And this is so valuable when you're applying on to graduate programs, especially clinical programs. There's not that many students, for example, who are applying into medical school who can say, I have 6 months clinical experience working full time at some of the top rated hospitals in the country. These are people who are also my references and can vouch for me. Also, I have 6 months full-time work experience doing research, and I really understand what that means. So our students are not only graduating with their bachelor's degree, they're graduating with a year's worth of full-time work experience in really real world settings that are just going to build towards their future. So our students are really competitively set up for any of the programs that they're looking to apply onto. So I hope that answers that question. Have any of you done a dialogue of civilization? No, I know the timing with the pandemic was not great for you. There's a great question. Me, Rebecca, you can answer this kind of quickly. There's a student who is interested in studying public health in other nations and applying it to our own. So dialogues kind of popped directly into my head, but they were wondering if that would fall into the public health area.
Yes, definitely. And as I mentioned, there's maybe I just briefly mentioned about the global health focus. So if somebody is looking to study global health, we have a global health minor that is very popular with the health science major, and is also great with the public health major, the BA in public health. And the dialogues is one opportunity that is available to students. It's a summer term. So summer is split into summer 1 and summer 2. So it's either the first or the second one. And students go on that term to another country led by a faculty member or 2 faculty members, take courses for credit that many of them do count within the health science program and the BA program in public health. But they get to travel and they get connected to local experts. For instance, there's a great one in London that we've done for years, and getting to compare the healthcare system in that country versus what we know here in Boston and the US. And yeah, so it's a really great way to explore healthcare elsewhere, but also there's a bunch of other different dialogues that look at maybe even more specific health questions in those other contexts. And then, yes, you can come back after that summer and have even a more rich idea of public health and engage in more coursework. Students can also do research. Some faculty might do research abroad, or they might get connected through a co-op to go work abroad, and also get that experience working in another country. So it's something that's very much promoted, and again, can be done through a lot of different ways. So it's just a couple to explore.
So I wanted to go back to Nicole and Eugenia to talk a little bit about co-op. Can you share a little bit, Nicole, about the differences between your two co-ops and how they were useful for you in your education?
Yeah, for sure. So I kind of went into my co-op search process knowing that I wanted to do two, and it's advised that you really diversify your experiences with those, so that way you get to know what you really want to do in the future. So I knew I wanted to immerse myself in a clinical setting on my first co-op. So I applied for a position in the OR at Mass Eye and Ear. And like I said before, I spent a few days in there before I was like, yes, this is exactly what I want to do. And then that kind of just built up the more I worked there. So it was incredible. And then coming out of that and applying to my second co-op, I knew I wanted to experience what research is like in a meaningful way, and not just do it very passively during the semester. I really wanted to immerse myself in that setting now. And it made me now something that I never thought that I would be interested in. I now love the idea of research, and I know I want to take that and incorporate it into my career when I do become a physician. So those are two things that I just wouldn't have known otherwise. And you really don't know it's something that you love until you fully live in it every single day. So I'm very grateful for those experiences.
That's great. Eugenia, can you add a little bit about your experiences?
Yeah. So at Mass Eye and Ear, I didn't know anything about ophthalmology. So I was like, you know what, whatever, I'll give it a shot, I'll see what it's like. And I was able to like shadow doctors in the clinic and in the OR, which was cool, but I did realize kind of creeps me out a little. I don't really like the eye, which is fine. Like you experience these things, and it's like good to know what you don't want to do, which is like also very important. And then I had already done I was at my research lab for like a year and a half. So I was like, oh, I have like pretty much like my research done. So I wanted another clinical co-op, and something that I've been really interested in was like women's health. So I was like, oh, let's see if I find like an OBGYN co-op. And then I came across this gynecology medical assistant co-op at Brigham. And I was able to be there all of last semester up until the summer. And it was a great experience. Like the doctors are very they want to teach you. They're also like Brigham is associated with Harvard Medical School. So they know it's a teaching hospital. They know that you're there to learn. So they actually put that like time to like show you and teach you stuff, which is I really, really appreciated. And then I loved it so much. I'm still like working there per diem.
I feel like that's fairly common. A lot of students stay at their hospital jobs. Per diem is like a part-time, like one Saturday a week, or like Saturdays or whatever, just keep the relationships going. You are pretty skilled workers by the end of your co-op time. So I think the hospitals are really happy to keep you paid and employed and have you on staff, which is really great for students too, because your job that you have during your college experience is something that is directly building towards that future, which is an amazing opportunity. Eugenia, can you talk a little bit too about like you were saying you were interested in PA and then you landed on pre-med. How do you like become a pre-med student at Northeastern? How does that process work?
So I came in, I don't think I had either pre-PA or pre-med like set at all. I just like told my advisor when I first met with him freshman year, I guess it was, yeah. Or when I came back from NUN, I met with them and I was like, oh, like I'm interested in pre-med now, like after deciding I didn't want to do pre-PA. And I was like, oh, how does it work? They're like, you just let me know. It's very simple. You just email your advisor or you meet with them and you're just like, hey, I want to be pre-med, they'll be like, okay, like I'll add you to our like their separate programming for like the pre-med students, and they like send out newsletters with very important dates and like a lot of like workshops and stuff to help you like build up your resume and like help you prepare for the medical school application process. And then same thing with like a minor. Even if you declare a minor like your last semester, you could just meet with your advisor. Very simple, and they're always there for help. Like anything you might need, they're there whenever.
That's perfect. Thank you. Yeah. Sometimes when I ask students, they're like, I don't remember, because the answer is it's very easy. You just let your advisor know. It's a really simple process. So as attendees, as you're looking at Northeastern, I know a lot of students will ask me like, how do I let admissions know I want to be pre-med? You don't need to do that as part of the admissions process. You can just select your major on the Common App and apply directly into your major. And then once you're here, you just let your advisor know that you're interested in being pre-med or pre-PA, or you're not sure, but you're thinking that. Advising is really great at helping make sure that you're taking the classes that are going to prepare you and not shut any doors. And then that was another thing I was going to say, when you're applying in, there's no supplements, you just apply directly into the program that you're interested in applying to. And if you're not sure, you're deciding between two, really easy to change your major. Like Rebecca said, it's also really easy through the admissions process too. So don't get too hung up if you're having a hard time settling in a major. If you're deciding between public health and health science, it's not the end of the world to select one and then change your mind at any point. It's really a fairly easy process to do. So don't let that give you any hangups. So we talked a little bit about, so we were talking about going into pre-med and going on to medical school or PA school. I just did want to mention, before switching gears to Alyssa, to talk about PhD programs. If you are interested in PA school, another great benefit of co-op is that our students are gaining the patient contact hours that they need to apply into PA school. So a lot of most PA schools do require a certain amount of direct patient contact before you can apply in. And most students are finding that they need to take a gap year between their undergraduate and a PA program to complete those hours. But through co-op, if this is something you're interested in doing, you would be able to do that as an undergraduate student and apply directly into a PA program. So we do have, like Eugenia said, a PA program here at Northeastern. So you'd be a competitive applicant for that, or any other PA program. You can go directly from undergrad to that PA program. So that's something else to consider. So Alyssa, there's a great question about students who are interested in their doctorate in public health. And I know you mentioned that Northeastern has one. But how well do you think Northeastern's preparing you for PhD programs outside of medical school or PA school?
I think it prepares you well. The requirements for like a PhD, for example, for Northeastern's is like a GRE, which is like a generalized test. So it's not like, oh, like, do we have like MCAT preparation or like DAT preparation? So it's kind of like not so specific that you would want like such in-depth training on it, if that makes sense. The thing that I think you really need are the letters of recommendation, and the fact that the public health or health science, whatever classes are so small, you have a chance to like get very close with your professors who can then give you a recommendation, which I know a lot of people fear when you're in like a really large class, like how can I get them to even know that I'm even there, much less ask them to do something like that. So I think that's like a big help. And then also we have like pre-health advisors who are like able to kind of help you and direct you in whatever direction you're interested in. There's a smaller selection of like doctorate programs for public health and for, you know, dental school, whatever it is. But it also helps you know exactly what they require and kind of aim for that. So it helps with that specification as well. So I think you're well prepared, and it's more of just like knowing who you can contact to vouch for your skills. Yeah.
Rebecca, is there anything you want to add on that?
Yeah, I think also the different research experiences that are here and the research institutes that are connected with our program. So we have many different centers for research and institutes for research that our faculty are a part of. And again, faculty that you have in class in these smaller classes that you get to know. And you can do an internship with one of our institutes that's on social justice and health. research and do or research assistant positions in any of the centers. But I think having that research experience, again, there's so many different opportunities for that around the university, but having that research experience is also a big preparation for a PhD, because that's what a big portion of PhD programs are, is doing the research. So if you have that experience, you're going to be well prepared for the PhD programs.
Perfect. Thank you. Eugenia.
Sorry, I forgot to
Yeah.
add that I'm a health equity intern. So if you have any questions about like getting connections for research through Northeastern, which is really helpful again, because some of them end up being your professors, I can also talk on that.
Yeah, I was going to ask, how easy was it? Because you all have participated in research, and that's not something all undergraduate students really have the opportunity to do. How easy was it for you guys to get involved?
In terms of applying for, oh, sorry, you want to go?
No, you can go. You go.
I'll be quick because my research experience was pretty much just co-op. So I knew that I wanted to dedicate 6 months during a co-op to research. So I didn't really do anything while on campus. But the fact that I was able to find a place that would take a very naive, inexperienced student like me at Mass General Hospital, like I would never have gotten into the door without this, like these established connections, and they have like a lot of trust in the Northeastern students from previous co-ops. So it was actually pretty seamless, and you find mentors there who just want you to learn as much as they want you to help them on their projects.
That's a really great point. I don't think you're probably as naive and experienced as you think you are.
Going into it, you'd be surprised.
But a question I often get asked is because on panels, students are like, yeah, but at the Brigham, yeah, I'm at Mass General. And I'm not, for people watching, I'm not selecting students who are just like at these top rated hospitals. These are opportunities available to all students. The panelists here are wonderful students, but they're definitely representative of Northeastern students. So all students have the opportunity to work at these amazing hospitals. This is not opportunities just for like the select few elite Northeastern students.
I mean, there's 2 students in this panel who worked at Mass Ioneer, which we make a joke that Northeastern students run that place because we're everywhere. We're in like every department.
You are. It's so funny because you think it's like such a niche, but it like, I mean, it's covering everything, all the skills. That's so great. Eugenia, you wanted to add something on research?
Yeah, I'm not exactly sure how I came across my research. I know I was just Googling like Northeastern research opportunities. There was a link that was probably the research page. I'm not sure exactly what it was. And I was just scrolling through it and seeing like, because they do it by like grades, I guess. It was like freshmen and sophomores, like opportunity for you to be involved in this research. And then there was a lot that were like wet labs, and it's all like through professors from Northeastern. And I didn't really want to do a wet lab. I was like, oh, I'm more interested in clinical research. So then I found the Center for Cognitive and Brain Health, and they had like an interview process. You met with them, they gave you a tour, and then it was like pretty like simple to get it's like a volunteer, like I wasn't getting paid for it or anything, but it was like good involvement. Like I worked like 10 hours a week, and you got like pretty involved with both the PhD students that run the lab and then like the participants. And it was like, I think it was a great experience and not too hard to find. There's like a database. I'm sure, I don't know what the exact website is, but there's a way to find it for sure.
Yeah, and they have a conference too in the fall.
Yeah.
Like professors, basically like table. It's like a fair for research opportunities. So it's pretty easy to get involved in research if that's something you're interested in doing. So we only have a few minutes left. So I just want to, before we wrap up, thank everyone for their time. Again, if we didn't get to your questions, or if you have more questions, or you want to get more in depth, please feel free to reach out to me. I'm happy to connect you with a current student. So I'm going to put my email back in there. So before we wrap up, Rebecca, if you can just briefly share why students should consider applying to this program.
Yeah, I'd love to.
Small question.
Yeah, I know. But yeah, I think this is a great program for anyone who, is interested in health. So it's a very broad area. Like I said, health spans so many different parts of life. But if you have any interest in health, this is the place to be. There are so many paths to take. We didn't even cover everything. We didn't even get to talk about physical therapy, but so if you have any questions about physical therapy, talk to Melissa as well. We have so many different paths to go on, and we really do focus on giving you the foundation, but then also helping you determine where you want to go and helping you along that path. So like I said, we didn't cover everything, but this is the place to come for health and get that experience, get those skills, and figure out what you want to do and how you want to address the challenges that you see in the world. So yeah, that's my pitch.
I love it. We didn't even cover how not only Northeastern's where to come, but Boston is where to come. Like, we are the hub of healthcare. You can't beat the location. And then students, for your final question, I'm hoping you can share, looking back at your time at Northeastern, if you can share an experience that you can't believe, like if you were high school, you looking at you now, like you can't believe something you've done. Bonus points if it's not co-op. It might not be. Yeah, Nicole.
Hi. I traveled for an alternative spring break trip. I got to go to the Dominican Republic and serve on a week-long mission volunteer trip. And that's something that I never thought I was going to be able to do. And I knew that I wanted to get some kind of abroad experience in. And so that was my choice. So instead of going to spring break and going home, I went to the Dominican Republic, and I was able to experience a whole new culture and really grow in that 1 week span. So that's my take.
Awesome. Eugenia, you want to go? You're thinking, I'll have Alyssa go next.
Yeah, I don't know. I don't know yet.
If you want to do co-op, it's okay. I'll let you do co-op.
No, I don't know.
I'll have Alyssa go. What do you think?
Yeah.
Okay. Well, I have two. Can I do two? Sorry, real quick. I
please.
think I also did an alternative spring break. I went to Nicaragua with Global Medical Brigades, and I got to like practice my Spanish. Like I said, I was a Spanish minor, and also do medical work that I just never thought I would ever see, like ever. And then also being able to present at RISE, which is like our research exposition. So work that I had done, like that just didn't sound like I was wearing a little suit, my heels, like it just was crazy. And then there were judges. So being able to speak on research I was doing, I was impressed with myself.
Yeah, that's wonderful. Eugenia, you have anything?
There's just so much that
I was
happens.
gonna say you did NUN, you've done research.
Yeah, I feel like probably NUN, because like I went abroad my first semester, and that's so scary. Like, what? Like, I already live in Miami, which is a plane ride away. Like, just going abroad was just insane, not knowing anyone. And then at least it was English, like was the language that they spoke, because it would have been even harder if that was not their main language. But I always wanted to travel abroad. I knew that from like the start. Like, I love traveling. I literally have a map in my room. Yeah, it's like a scratch off. I literally only travel in Europe, as you can see, but I need to go everywhere. I was able to like obviously go to classes and be able to travel on the weekends, which was like huge for me. And I knew that as like a pre-med, a lot of medical schools don't accept like science courses that are not in the United States. So I was like, I feel like this is going to be my only opportunity to go abroad. And I really wanted to do an alternative spring break so badly. I wanted to do global medical brigades, but I get really homesick in the spring, and that's my only time to go home. So I didn't, which is kind of a regret of mine. But I did something similar in high school. So I'm like, okay, it's fine. Like, I have some experience in that. But yeah, definitely, like, if you do get the chance to travel abroad through Northeastern, through a dialogue, through, I don't know if anyone here is an NUN, would get an NUN. Like, I highly suggest that. It's a great way to just immerse yourself in a different culture and learn from others, and just like expand your knowledge and like everywhere, like globally.
That's wonderful. Thank you. Yes. And NUN is a really great opportunity. So if you do go into that program, that's a wonderful way to study abroad that won't impact any medical school applications. And then there's also a spring semester abroad called Global Quest. So I definitely can talk to anyone who's interested in hearing more about global experiences. Eugenia, I think you could do like Doctors Without Borders or something once you become a physician.
I really am considering that, like, so much. I really want to do it.
That's great. Yeah. Well, thank you all so much for your time. It was really great to hear from all the panelists. And Rebecca, thank you so much for talking about the programs. It was really great to hear about the differences and similarities. And we hope to see all of you on campus next year. Thank you so much.